If you believe that health care is a fundamental right of all Americans, then last week was a Herculean day for all Americans. John Larson played such a critical role in the House leadership. Obviously, Nancy Pelosi, the Speaker of the House, did a phenomenal job in marshaling the necessary support. Harry Reid, he had, 7,000 or 8,000 people show up in the tiny village of Searchlight, Nevada the other day. I said, that's quite an honor, Harry, to have that many people show up in your hometown. The other day, protesting over the idea that a Senate leader had tried hard to see to it that millions of Americans would have the fear lifted from their shoulders that if they get sick or their loved ones do, they could have the access to a doctor. I've always said it's somewhat ironic. I'm a strong supporter of the idea that if you're accused of a crime in this country, even the most heinous of crimes, you have a right to a lawyer. That's a right we extend to all Americans. Won't history think it's somewhat ironic if a nation that extended that right to the accused would not extend the right to a doctor for the sick and the injured in our country? And that's important as well because there's been so much confusion about this and what's in this. And the great news is that we in Connecticut, along with others in the country, are going to benefit from this legislation beginning this year. And that's been not as well understood as it should be. There are longer-term benefits in time. Obviously, a lot of this will need to be worked out in the coming years. But the idea that this year, there were 37,000 small businesses in our state. Kevin Galvin, a wonderful friend who organized and did such a great job of organizing small businesses in Connecticut, can speak to this. 76% of all of our businesses in Connecticut are small businesses. And yet only about 50% of those businesses are able to provide health care for their employees in our state. And that's pretty much true across the country. In fact, I suspect it's better here in Connecticut than most states. As a result of the bill that passed the other day and signed by the President, now all of those small businesses in Connecticut across the country will get a tax credit to help them alleviate the cost of health care for their employees. That can make a huge difference for literally hundreds of thousands of people across this country and thousands of people here in Connecticut. Thank you, Kevin Galvin. Families, for the first time, the children of this state, if you have a pre-existing condition, beginning this year, you cannot preclude a child in Connecticut from getting health care coverage because of a pre-existing condition. That's a major breakthrough for children. If you're an older American here in the state of Connecticut, and thousands are, then we're going to start to fill that donut hole. And thousands of our fellow citizens who reach retirement age ran into that donut hole. That is that period of time when after they've exhausted certain revenues would have to dip into their own pockets. Many who are living, of course, on fixed incomes provide for those prescription drugs. Beginning this year, we're going to fill that donut hole. Thousands of young people in our state who reach the age of 19, 20, 21, finish college, and all of a sudden find themselves what we call the young immortals, those who think they're never going to get sick and never going to get injured. And all of a sudden they're no longer able to be carried by their parents' insurance plans. Starting this year, up until the age of 26, if you finish school, even if you haven't finished school, you can get covered by your parents' health insurance plans. That's it. Beginning as a result of this health care plan, people worry about the rising debt, and legitimately so. According to the Congressional Budget Office, which is the policeman when it comes to finances, we will save $143 billion in national debt in this country as a result of this plan, and $1.2 trillion in the second decade. That's a major, major achievement for our country to reduce that national debt. That's going to start right away. Lastly, right away, jobs, obviously. We all know how hard this has been. People here in our state and across the country, the economy, getting people back to work. We're estimated again by those who've done the analysis of this legislation that beginning this year, anywhere between 250 to 400,000 jobs can be created in the healthcare fields. That's between 4,000 and 6,000 jobs here in the state of Connecticut. Because of expanding those opportunities, opening up those doors for healthcare coverage and services for more and more people, that creates jobs in our country, and nothing is more important than putting people back to work in Connecticut and across this country. This is legislation that will kick in over time. But those are the provisions that begin immediately in this legislation, making a difference. When people say, well, we can't afford to do this, we can't afford not to do it. When you realize we are consuming as much as 17% of our gross domestic product in the country. And the estimates are we would jump to around 35% of gross domestic product. Our country could not afford that in this nation. Today in Connecticut, the average family of four spends $12,000 for health care premiums. That's double what it cost only less than 10 years ago. And we're told that if we didn't act on this legislation, that $12,000 for that family of four within the next 7 years would jump to $25,000 for a family of four in Connecticut. Who could afford that? We would have more and more uninsured in our country, clogging our emergency rooms because that becomes the primary care physician for many. And as a result of this legislation, we're going to be able to reduce those numbers, keep down those costs, put some restraints on the rising cost of premiums all across our nation. That is a major savings to the American people. Franklin Roosevelt talked about the four great freedoms back when he was President of the United States. The freedom of religion, the freedom of speech, the freedom from want, and the freedom from fear. Freedom from want and freedom from fear. This legislation addresses both of those. Not that we wipe out all the necessary freedoms from want and fear, but the idea that if you or a loved one in your family becomes ill or injured, that you're not going to go bankrupt in the process. Last year, 750,000 of our fellow citizens went bankrupt in this country because of a health care crisis. A health care crisis. And close to 65% of that number had health insurance. It wasn't that they were uninsured. They had health insurance. But the deductibles were so high, the out-of-pocket expenses were so high, that it put them underwater financially and they went bankrupt. That ought to never, ever happen in the United States. This was the passion of Ted Kennedy's life for the 47 years that he served in the United States Senate, to address the health care crisis in our nation. He saw it firsthand with his own sister, who suffered from mental retardation. He saw it with his own children, young Teddy, who lives in our state, when they went to get that cancer treatment on those trial programs, and then discovered that it was no longer a trial program and you had to pay for it. And the other families that were in that trial could not afford it, and asked if they could get a third of the medication, or a half, or a quarter of it, to save their child's life. That was the epiphany for Ted Kennedy. And he said, there's something terribly wrong when my family, because of its wealth, can take care of our child, but the other members of those families here who don't know those resources cannot. We need to change that in America, and we are in his name. Thank God for Ted Kennedy. I've been involved in a lot of issues over the years, obviously in 36 years in Congress, going back to the days when I had a head of black hair, no longer white hair. And I'm proud of many things I've been involved in over the years, from family and medical leave and child care and dealing with autism and premature births and infant screening and after-school programs and a whole host of issues, which I'm deeply proud of. But never a prouder moment than to be in the East Room of the White House a week ago today and watch the President of the United States sign the legislation that for the first time in our nation begins the process of seeing to it that we can be free of that fear that if we get ill, if we need help medically in our country, that we're not going to be excluded so because of, again, our station in life, our economic circumstances. It's a great day for our country, one of the best days we've had in decades in our nation, and I'm deeply proud to have been a part of it. And I want to thank the people in this room, many of whom have been active and involved. Proud of my state of Connecticut, which once again was on the cutting edge of these issues, doing things in our state legislature to try and make a difference here at home. And all of them deserve a great deal of credit for speaking up and standing up on behalf of the people of our state. We have more work to do, obviously, getting people back to work, getting our economy on its feet again. John pointed out, I'll now chair the committee dealing with the floor of the Senate with the financial services reform, and we intend to get that job done as well to make sure that this was a great day, and we wanted to come back here and say thank you to all the wonderful people in Connecticut who helped us in this process, and again, some wonderful people.